Welcome to the cranial nerve testing demonstration video. This is stemming off of our comic strip that we created with Toondo that gave a little superficial approach to the cranial nerves and some information about them. Now, like I said before, we're going to go into our cranial testing. These are tests that you will do to make sure that all 12 cranial nerves are functioning properly. Alright, the first of the cranial nerves is the olfactory nerve. Now, like we said before, the olfactory nerve is responsible for the sense of smell. So to do so, you test a person's sense of smell. Whiteboard marker. My patient Alex, his olfactory nerve is working just fine. The next cranial nerve number 2, is the optic nerve. Like we said before, this is the nerve responsible for vision and the ability to see. So, Alex, how many fingers am I holding up?
2, 4, 5, 9.
The optic nerve is working just fine. The third nerve is called the oculomotor nerve. This nerve is responsible for up, down, and medial gaze of the eyes, as well as making sure that the pupils constrict when given the presence of light. Let's track his eyes. You go up, down, focus on your nose. Good. Now let's check the sensitivity to light. His oculomotor nerve is working just fine. Next up is the trochlear nerve. This nerve is responsible for a down and lateral movement of the eyeball. Focus on the pen. His trochlear nerve is working just fine. Next, we have the trigeminal nerve. This is the 5th cranial nerve, and the way to test it is testing his ability to clench his teeth, as well as his sense when touching his face. So Alex, while looking at the camera, I'm going to have you clench your teeth. Alright, that's working. Now, can you feel this? And can you feel this? How about this? His trigeminal nerve is working just fine. The 6th cranial nerve is the abducens nerve. This nerve is responsible for strictly lateral movement of the eyeball. It's working just fine. The 7th cranial nerve is known as the facial nerve. To test this nerve, we'll have our patient squint their eyes, smile, and even whistle. Alex, can I have you smile while squinting your eyes? Good. Now can you whistle? Nice. Working just fine. The 8th cranial nerve is the vestibulocochlear nerve. To test this, we will be testing his balance as well as his hearing. To do so, I'm going to ask Alex to stand on one leg to test his balance while checking his hearing. Can you hear this? Can you hear this? Let's try the other way. Can you hear this? Can you hear this? It's working just fine. Cranial nerves 9 and 10 are the Glossopharyngeal nerve and the vagus nerve. Both of these are pretty similar and you can test them sort of the same way. The Glossopharyngeal nerve is responsible for a gag reflex as well as swallowing. Right now I'm not going to test Alex's gag reflex, but I'm going to ask him to swallow. Works good. Now for the vagus nerve, along with those two features, it can also be tested by simply going, ah. So, Alex, can I have you?
Ah.
Works just fine. We're almost done. The 11th cranial nerve is known as the accessory nerve, or spinal nerve. To test this, I'm going to be testing Alex's ability to resist this shoulder shrug. I'm going to have you shrug your shoulders. Don't let me push them down. Working just fine. The 12th and final cranial nerve is the hypoglossal nerve. To test this, I will ask Alex to stick his tongue out and make a burrito. Best way I can think of putting it. However, for this, if there's a problem with the cranial nerve, then the tongue will move to either the left or right side, depending on which side is damaged. Can I have you stick your tongue out and make a burrito? Nice. All of Alex's cranial nerves are working just fine.